The past year has been a year of disruption, and every healthcare facility has felt the impact. Financial pressure created by COVID-19 and compounded by a critical staff shortage means that we need to do more with less. As an industry, we must rely on predictive and prescriptive analytics tools and cutting-edge lean principles to transform capacity management. Better healthcare is possible through better math. Over the next 2 days, you'll hear from leaders in healthcare and experts in AI, participate in breakout sessions by field of expertise, and learn how your peers are using analytics and AI tools to optimize their core operational processes. Leave with a new understanding of how you can harness the power of data to improve utilization, increase patient access, and unlock capacity. Start working towards your future. Take the first step to transform.
Throughout your book, a theme that comes up is the supply-demand matching. You talked about it from information, from testing, and even now when you talk about the labor and the wage pressure, it's a matching of supply and demand. As you know, our whole premise in the products we build is around matching the supply and demand for assets. So we focus more operationally on the assets like operating rooms and imaging and so on. What do you think health system executives need to do to get more sophisticated on the intricacies of supply and demand matching?
Yeah, look, I think that this gets back to some of the other questions. I think that there are going to be a lot of opportunities because we have access to better information and the ability to use predictive algorithms on top of that information to make better estimates of what demand's going to be in healthcare. For example, I think right now we're in a position probably to try to measure some of that excess morbidity. And you're seeing some studies come out trying to do this right now on what future demand's going to be in certain spaces like oncology, where you could sort of make predictions based on past patterns of what the impact's going to be, for example, of the missed visits, the missed routine screening, what the rise in incidence of cancer is going to be. And you're seeing some of those studies start to come out. So I think that there's a real opportunity to use access to data where we have much better access to large data sets, both historical and prospective, combined with predictive algorithms for provider systems to get more insight into what future demand's going to be. And a lot of you're using those tools. A lot of entities are starting to adopt those tools. I think that you're going to see an acceleration because this also, this isn't really a regulated space. You're using these tools to sort of inform business decisions, not inform necessarily clinical decisions in the context of a single patient. So this is the real area where you could see more rapid adoption of these kinds of tools, similar to what other industries have done.
In short, I think the lessons that we've learned and that I hope to share with all of you, when we look to leverage technology and artificial intelligence, right? It's a lot of hype often in the media and in the publications that we all receive. Helping organizational leaders really tie this work to the strategies and problems that they're already dealing with and facing is a really important piece in laying the foundation for this work. Again, can't underscore enough the need to partner with clinical and operational champions, that they are sort of at the leading edge of the impact of this. If it doesn't work, the IT team doesn't lose out all that much, but when operations goes sour, it's those clinical and operational champions that really bear the brunt of that. And so their strong partnership, their commitment, and their support is absolutely critical. Focusing on quick wins and building the momentum. After the first 3 months in the first 2 infusion centers that we deployed, we looked at our results. We were very transparent that it was a short amount of time and just a small subset of the infusion chairs, But we told that story in lots of forums where it was important for other clinical leaders, other service lines, the areas like the operating rooms, even our cath labs, the inpatient beds. We started to build that momentum to share the success, very practically talk about any of the challenges that we faced. And really our challenges rested in the change management, the operational changes, and trying to do all of that in the middle of a pandemic sort of slowed some of that work down. But important point again is to build that momentum, share the story, and let the data sort of speak for itself. Again, really important, choosing that third-party partner who shares your vision. I'll say again, LeanTAS isn't our only partner, but it's filling a really important need. I personally, my philosophy is neither best of breed. I don't want, 15 or 20 different solutions, but it's not one size fits all either. So that small handful of tools that's going to help you with your problems is really important. And for some of these really big problems that I mentioned, LeanTAS has been that really strong partner for us. And then, as I said, celebrate the successes, build the commitment, and tell your story. I'm here today to really help share, hopefully, what is some encouraging news and light at the end of what has been a long tunnel around some of these really big challenges.
Having the one way of reporting the data and allowing everybody to look at the data has made a tremendous difference, even in the COVID crisis. I appreciate the customer service you guys have. It's been extremely helpful in getting things launched.
Current state, physical space continues to be a constraint for us, and with our volumes ticking back up to pre-COVID volumes, capacity management has been a main focus. We worked with our team at LeanTAS to explore possibilities for alleviating some of the load, and one of the main areas of opportunity was level loading patients to Tuesdays, which are historically the lowest volume day for us across all of our units. In addition to level loading some of our visits to Tuesdays, we also recently implemented different scripting to align with best practices for scheduling. Historically, our schedulers have asked patients what time they would prefer to come in, and if that time was not available, they just add them to a wait list. And that's frequently the case that the time that they want is not available. So current state, we are offering patients a choice of different available appointments with the hope that one of those times will work for them. And then we can avoid the waitlist process entirely. After the scripting change, we saw an increased utilization of Tuesdays, and we also took our waitlist from a high of nearly 500 patients within a 3-month period to a low of under 100.
When we went live with IQ, this would have been the last quarter of 2019. We actually saw a 4.5% increase that first quarter on this campus without having to expand any available time on our grid. We didn't add any additional staff. We didn't add any additional asset in terms of rooms. And then now, as we're kind of coming out of this last wave of the pandemic here locally, we're now able to continue that additional throughput for our patients, and so that we're able to do as many cases as we possibly can.
After using IQ, we saw an immediate increase, almost 70% of in-block utilization and almost 80% staff room utilization. In this current fiscal year, we're so far off to a very good start with over 75% in-block utilization, which I think is very good for an academic medical center.
We noted the 90% improved confidence in critical capacity decisions. So what we meant by that is making decisions on whether our access center will go on a delay or redirect protocol, decline protocol, or even when we talk about delaying procedures, et cetera, during the COVID pandemic. And what we've been able to do is that really using real-time data and predictive analytics that have proven to be phenomenally accurate so that we can make the best decisions. So historically, you know, the decision that I might make as an AOC versus a decision that my colleague might make as an AOC, that we make on a Monday versus a Friday. Now we use data and our predictive balance and bed balance to drive those decisions. So there's less gut and subjectivity and much more objectivity into how we're making decisions. So we've been able to do two things. One, stay off of delays and redirect protocols unnecessarily, but two, actually go on them earlier because we can see that we're going to be in trouble. So we've been able to sort of benefit on both ends of that spectrum because we're using that predicted balance to make decisions versus I'm not exactly sure where we're going to end up. The amount of time and what we would do historically, we would go sort of stand up our command center, which was a little room with, you know, director, VP level people to go make decisions, to escalate delays, to address barriers. And now that's just SOP. And we don't have to go all sit in a command center and cancel our meetings for the day. We really leverage this tool to guide how we make decisions.
You know, we've been able to set goals for our nurse managers and our leadership teams directly within the product. And the way in which the tool also pulls in the data to compare our current performance against those goals is invaluable, because historically in IQ, we've really been able to measure our performance and understand how we're doing, but it really didn't have that component of explaining or displaying where we should be and whether or not we have a gap between where we are and where we want to be. So this tool really shows us at a glance the different areas where we're either doing well or perhaps not so well.
So some of my key takeaways that I hope we bring away from this is that modern infusion clinic logistics far exceed the capabilities of any single department. So if you feel like, well, you know, we can get patients through if we just improve nursing, or if we just improve pharmacy, or we just improve lab, then we've somewhat missed the point of what I'm saying. We're all interconnected in what we do. And really, we all have to find a way to leverage efficiencies and data more effectively, but as a cohesive unit. When they're here, they're coming into our service as an infusion clinic, and that means all of us have equal partnership there. The interwoven nature of oncology demand solutions that address both upstream and downstream logistics. So we can't address one without the other. Pharmacy is a clinical service that has a robust manufacturing operation that's vital to your overall performance. So please, please, please be kind to your pharmacy team and just understand that they're really involved in a lot of aspects. We're not just there to verify the drug and compound the drug. That is a gross underestimation of what we bring to the table. And right now, no acuity exists that can correlate between both nursing and pharmacy demands for an individual patient. And we find that ability to bring that together, and I would also probably add in bringing in that lab aspect of it as well. That's going to be the solution that I think really takes us forward and pushes this from a more cognitive development perspective of what infusion clinics can really operate. They hit the top of their capability.
Okay, so why am I telling you this? Why is this relevant to an infusion center? So I want you now to take each one of these cashiers and assume for a minute that each one of these cashiers is a nurse in your infusion center. And each one of these circles, these customers, is actually a patient that is in her or his queue of patients for the day. So if we assume that most centers do some sort of a pre-allocation of patients, whether it's the night before, whether it's a day of, each nurse will know what their general slate of patients looks like. So in the morning, what they know is basically the same thing that you know when you're standing here waiting to go and how old they are. They have a general sense of their acuity level. They know what the treatment regimen is that they're there for. They know if they're a new patient. They know if they're a clinical trial patient. So they know a fair amount. Just like when you're standing here, you know a fair amount about which line you want to go into. You know how long it is. You know how big the basket is, how fast things are going in terms of that cashier. What that nurse doesn't know, though, is she doesn't know who's going to come on time. She doesn't know who's going to come late. She doesn't know who's going to get stuck in a doctor's appointment that goes for a long time. I refer to times when you have multiple things go wrong simultaneously as wrecks on the interstate. All right, so is that just a permanent condition? It's actually not. So let's look at what the alternative is. So the alternative looks something like this. So now we're going to switch gears and we're going to go to, not to the grocery store, but we're going to go to several specific retailers. In this particular case, it's going to be, you've probably all been to a Best Buy, you've been to a Joann Fabric, you've been to Marshalls and TJ Maxx do it this way. So again, we've got the same 5 cashiers that we had before. The difference is that instead of having each one of them have a fixed line like we had previously, we're going to have everybody queue up and we're going to have everybody queue up into a single line. All right. So you've all seen this before. Again, if you've been to Best Buy or Joann or wherever else. So this is what it's going to look like. Now, what happens in this particular situation? So you've all been in this, this situation before. So you know that so let's put all of these folks in line right now. This is roughly the same number of customers that we had in the previous slide. And now each one of these cashiers is going to take the customer as they are available. So I would encourage you as you look to 2022 to think about how a complete change in your approach to how you do your operations might lead to a completely new look and feel of your operations overall.